You're listening to Psych with Mike. For more episodes or to connect with the show with comments, ideas, or to be a guest, go to www.psychwithmike.com. Follow the show on Twitter @PsychWithMike or like the Facebook page @PsychWithMike. Now, here's Psych with Mike.
Welcome into the Psych with Mike Library. This is Dr. Michael Mahan, and I am here with Mr. Brett Newcomb.
Hello.
How are you today?
I'm doing well. We have a guest.
And who is our guest?
Kelly Locker, who is a certified hypnotherapist and a licensed professional counselor.
Can you say that
private practice?
3 times fast?
Probably not.
So, Kelly, it is fantastic to have you. Thank you so much for being here. Why don't you introduce yourself and tell us a little bit about you and what you do?
Yes, I'd be happy to. First, let me thank you for hosting me here and allowing me to be a guest on your show. So I'm very excited to talk about hypnosis and hypnotherapy. So as Brett said, yes, I'm a psychotherapist and a certified hypnotherapist in private practice in Kirkwood. It's called Happy Brain because we believe in happy brain and making a happy life. So I became a certified hypnotherapist, though, before I was a psychotherapist, and that really was born out of meditation practice that started over 20 years ago. And I started to become fascinated with the mind and the powers of the mind and what it is that you can do and achieve with the mind. So I got interested in hypnotherapy and got trained in it. As Carl Jung says, making, until you make, this is what I'm trying to get this quote right, until you make the unconscious conscious, you will, now I'm forgetting the quote, you will,
essentially that you will
I'm forgetting the
continue
quote
to make the same life-inhibiting mistakes over and over and over again.
Yeah, essentially that's what he's saying. Until you make it detailed and make the the unconscious conscious, then it is going to basically run your life for you instead of so you're going to be a slave to the unconscious instead of being the master of it. And so that really got me interested in learning more about hypnosis, and I think my hypnosis practice really informs my practice as a whole, because I think that, they say upwards of 80% of your daily behaviors are subconscious. So a lot of us really, we're walking around on autopilot, and all of those habits, patterns, programs, belief systems are informing our daily choices, our daily decisions. So if you're not understanding the principles by which the subconscious mind works, then you end up being a slave to it instead of the master of it.
And Brett and I both are certified to do hypnosis. Neither one of us ever made it the primary focus of our practice, but we have done an episode on hypnosis for the podcast before, and it is still the single most downloaded podcast that we've done. So clearly, there are a lot of people who are very, very interested in the topic and in the subject. So
more than 5, less than 5 million.
Yes, it's right in that range.
Yeah, right in there somewhere.
Right in there. Split the difference. And so tell us from your perspective, what is hypnosis? What are we doing when we are hypnotizing people?
Well, there's many definitions of hypnosis. First, you have to understand that all hypnosis is self-hypnosis. So it's not something that I am doing to people. It's something that I'm facilitating, something that I'm guiding. Of course, if they want me to. So if they allow me to facilitate and guide the process, then I'm working with the natural ability that they're born with. I say that it is focus and concentration coupled with mental relaxation. Another way of saying it is it's an altered state of consciousness. So you're not unconscious, you're not asleep. It's just simply an altered state of consciousness. So, and again, if they allow it to happen, I can facilitate it for them. But because all hypnosis is self-hypnosis, you go in and out of hypnosis every day on your own. And we call that waking stage hypnosis. So everybody understands and knows about highway hypnosis or driving hypnosis. So if you go back and forth, home to work, work to home, it is a familiar route, which means the route to work is a hardwired program. So you'll pull into your driveway and not remember the last 10 minutes or 20 minutes of the drive, and we call that waking hypnosis. Basically what that means is you're operating primarily from the subconscious mind. The subconscious mind takes a front seat, the conscious mind takes a back seat. Subconscious mind goes on autopilot, drives the car for you. It frees up your conscious mind to think about whatever you want to think about.
So I've talked about that a lot in therapy, this idea that you do things just through muscle memory. I've never thought in terms of that being hypnosis. That's really interesting to me. That's actually never been something that I've thought about. So would you then say that during those periods when we are experiencing that waking hypnosis, are we open to getting epiphanal information from our subconscious?
Yes, you are open to that. What that means to the hypnotherapist is you're more suggestible at that time, so you're open to suggestions. But, I think, and when we do it in hypnotherapy, we're looking to reach a little bit of a deeper state, to be able to work with the subconscious and uncover more material that you may not be consciously aware of that might help you in your daily life to create change. So yeah, that's definitely possible. But again, we're looking to achieve a deeper state therapeutically in order to do therapeutic work. But it's just an example of how we go in and out every day on our own. And if you practice relaxation techniques or meditation or yoga, then you're just enhancing that skill or that ability to be able to go into that altered state and then go much more deeply.
So what techniques or stratagems do you use to deepen a trance? How do you induce them, and then how do you get them to go deeper?
Well, there's different ways to induce them. I mean, we have different types of inductions that we can use. And sometimes, I use a lot of Ericksonian type of metaphoric stories and imagery and positive language.
Milton Erickson.
That's Milton Erickson,
Yes.
Not Eric Erickson, just for people.
Oh, yes, Milton Erickson.
Not everybody will know that, so.
Okay, yeah. And so there's different ways of doing it. It could be eye fixation techniques. It could be confusion techniques to confuse the mind, to, have the mind fixate on something, and then that helps create the induction. And deepeners, I usually use, visualization or, some type of counting or a stairwell type of imagery, things of that nature to deepen it. It could be as simple as creating, the light, the heavy arm, and then telling them, that the arm is going to feel heavy, and, I wonder how heavy it is. I wonder if it feels like there is a bucket of bricks hanging from it, and then I lift up the arm. I say, don't let me lift up that arm. In other words, don't assist me, don't try and stop me either. But I pick up that arm, and then as I pick up that arm and I drop it back down, allow yourself to go 10 times as steep. And so I can do.
That's interesting. I remember the first time I ever hypnotized somebody. I used the descriptor of getting on an elevator and going down floors deeper and deeper and deeper, and we did whatever work we were doing, and then I brought them back up. And when they got off of the elevator, they opened their eyes. They were supposed to be awake, and you can tell me to remember or not remember whatever conversations we had. But this individual opened their eyes and had a panic attack. And I thought, crap, I got this wrong. What have I done? And what I had done was not pre-certify that she didn't have a fear of elevators. So I'm supposed to check that out ahead of time, so that you have other alternatives, like visualize dates on a calendar going backwards, like you see as a movie device sometimes. But if you don't know, then you can, it wasn't an issue because she was already in a trance to deepen the trance. But when she came out of the trance, it was an immediate issue for her. She had a panic attack. And then I had one.
That's
like, what have I done?
I would have never thought of that. That is actually really good information. Yes, Now I've never used elevator.
But it could be anything.
Yeah, but it could be anything. Right. Yeah.
So you want to, even though one of the challenges of doing good therapy is always to try to use the language of the client.
Yes.
So if I have a truck
language.
driver, I want to use driving and highway analogies. If I have a computer person, I want to use computer technology about the way mind works. But another thing is to find out, are you afraid of something? Because I don't want to inadvertently put you in a fear state when you're not able to use your normal defenses to protect yourself from it.
Yeah, exactly. And I do a little pre-relaxation exercise in the the pre-talker. as we're talking about what it is that the client wants to be able to achieve. And this exercise basically tells me, how their brain best processes information. So I'm looking kind of for that learning modality. Are they more auditory? Are they more visual? Or are they more kinesthetic? And in that, I have them go to a place and imagine it with all 5 of their senses. And I oftentimes will use the place that they go to, kind of thing. If they don't ever go to, like a beach or something like that, they might tell me, oh, because that's one of the most popular places people go. Just
The
they go to
beach.
the beach, they go to the ocean, and I've had clients tell me, oh no, I don't like water, I don't like the ocean. So I want to make sure not to include any of that type of visualization or whatever in the actual hypnosis session. But then that tells me how their brain best processes information.
Because you want them to relax and hyper-focus on whatever scene you're generating so that their anxieties quiet down and their need to protect themselves with their defense mechanisms quiet down. And then you can approach something that...
Yes, because it also tells me whether or not they're suggestible or not.
Right.
If they can't even imagine a place and they won't follow those simple suggestions, I'll say, I don't think that you're ready for this at this time. Because, that's one of the things that people worry about too, is losing control, while being hypnotized kind of thing. And I say, no, you're in control the entire time. In fact, I can't even hypnotize you if you don't allow it to happen. So if somebody says to me, you can't hypnotize me,
Right.
I'm going to say, you're right.
Right.
But if they say to me, oh, I don't know, I think I could be hypnotized, I'm going to say, you're right, because it's whatever you believe.
Right.
So, yeah.
Well,
if
people
they don't-
have images of stage hypnosis, party hypnosis, where they make you bark like a dog or sing a song or do something you wouldn't normally do that makes you look foolish. And I would always talk to people about that's not real hypnosis. It's not clinical or therapeutic hypnosis. So if you are receptive and you feel safe enough and we can do this, then if I ask you to remember something that you're not strong enough yet to remember, like a lot of times people would come in and they would want hypnosis to look for sexual trauma histories. And I would encourage them not to do that. I would say, you know what, let's
I
just
agree.
do the regular work that we're doing, and as you get stronger, you may have some flashbacks or have some memories that you don't have right now. But you'll be strong enough then to handle them. Also, there are all kinds of legal ramifications for trying to do regressions and memory recovery work. So I would resist using hypnosis as a strategy for that. But if I were to try to do that and ask you to remember something that you weren't strong enough yet to handle, you would immediately come out of the trance. Or if I asked you to do something or visualize something that you would not do, like confront your mother and imagine what you would say to her, you'd come right out of the trance. Or if I died of a heart attack while you were in a trance, you'd come right out of the trance. You wouldn't be there for the rest of your life, not able to come
you're
back.
not going to get stuck in hypnosis. I tell people, one of two things happens. If you're in a deeper state and you don't recognize that my voice, or don't recognize my voice being in the room, you're going to drift into a natural state of sleep and you'll wake up feeling
Right.
nice and refreshed.
Right.
If you
when your body
recognize
says,
my voice
I have to go to the
is
bathroom,
left,
just like it normally does. Yeah.
Yeah. So eventually you come out of the hypnotic state all on your own. So yes, you can't get stuck in it. That's true.
So the idea is that our consciousness is like an iceberg. This is one of the
Yes.
analogies that people use, and that the amount of our conscious awareness is the amount of an iceberg that you see floating above the water, and then your unconscious is everything that is below the water. And so we have a wealth of information that's available to us that we don't have conscious access to. And so through this hypnotic trance, we are trying to allow an individual to access information that is in that unconscious. To what end? What is the purpose? If I can access this unconscious material, what am I going to get out of that?
Well, it's like we said in the beginning, it's making the unconscious or subconscious, as I call it, conscious, but it's to create change in your current lifetime. Because if people then are worried, are coming in because they want to change something, and they want to work on something, well, again, it's probably something that they're doing on automatic pilot and not even realizing it, which means, so it's some sort of habit, pattern, program, or belief system. They're just not aware, that they're operating underneath this, I guess we could say that, from this hardwired program. So, I mean, I'm just helping them understand the manner in which the subconscious mind works, and hypnosis just makes it easier to work directly with the subconscious mind versus doing it on a conscious level. You can create these changes, you can change habits and patterns on a conscious level. It just takes longer.
So I think that's a great point, and I agree 100%. So we could do all of the things that we do with hypnosis without hypnosis, but it would take much longer.
Yes.
Well, let's talk practicalities in terms of specific issues that people can benefit from hypnosis for. And I notice on your brochure that you talk about weight reduction and smoking, which are things a lot of people I think know about.
Yeah.
That's a technique for. But athletic performance, confidence building, insomnia, pain control. I remember having a client that came to me for some work with pain management and pain control because she needed to have a hip replaced, and there was some reason why they couldn't do it for several months. But she was having just devastating pain in her hip. And so we worked on getting control of that pain and reducing it to a smaller and smaller and smaller ball that she had control over. And that helped her get to the point where she could have the surgery without being crippled and unable to function in life. And I remember having athletes that would come in and want guided imagery before a big competition of some kind to imagine their best performance or their successful performance. We have no control over whether or not they win or score or whatever that is, but we can help them manage their anxiety and marshal their resources in a focused way. At least that's my understanding. So since you do this work more deeply and regularly than I do, could you talk to those things?
Yeah, so yes, if you can see it, if you can then feel it, you're more likely to be able to believe it. So we want, speaking of the athletes, they work endlessly, right, to perfect their physical performance. And that does help create that muscle cell memory. It's great. But what happens is the conscious mind, right, it tends to get in the way and it mucks them up because they're not operating from that subconscious mind. So we're working then to get them more into what the athletes call in the zone.
I was just going to,
in the zone, right? Because if you talk to them about that, they know exactly what that is. They're like, oh my God, yeah, I was like on. I was making every shot, hitting every putt. I mean, I could do no wrong kind of thing. And I tell them, when you're doing that, you are operating from the subconscious mind. Again, subconscious mind's in the front seat, conscious mind takes a back seat, and you're not allowing that critical thinking part of the mind to get in the way.
Anxieties, distractions. Like watch a basketball game, you see people waving things in front of the shooter,
right.
Trying to distract them.
Right, you're not thinking. And what I see this most with, I've worked with many different athletes, but mostly with golf. Because with golf, everybody says it's such a mental game. It's true. Because it's the only game where you get to think about every shot you make because the ball is not in motion. It's still. So this is where the critical mind then gets in the way and causes problems. So if we can quiet that critical thinking part of the mind, and then we use that imagery too to see you performing your best game ever. We can work on the long game, the short game, whatever it is that you need help with specifically. I help create anchors, so I'm anchoring a certain emotion to a physical body part, and you can use that anchor. Tiger Woods used anchors like that. He did blinking of the eyes, and every time he would blink the eyes, it helped to get him in the zone. So I'm anchoring the feeling of being in the zone to a physical body part.
And you teach them that, so they can basically hypnotize themselves and put themselves in a trance at a certain state.
Yes.
So
that's a post-hypnotic.
I know of a case where a lady was having some dental work done, and because she was dissociative identity disordered, every time they would put painkiller in her mouth, she'd switch personalities, and then the painkiller wasn't effective because that personality didn't get the shot. So they actually had a hypnotist come in and work with her on being able to say, okay, she stayed in the room with the dentist, and they could say, okay, we need you to not feel the pain, or we need you to stop the bleeding or slow down the bleeding, or whatever they told them to do. But if they were going to do a series of things in this woman's mouth, which needed extensive dental work, they taught her a trance induction cue, like a word, blue ribbon. and they'd say blue ribbon to her, and she would immediately go to that level of trance. Is that
Yes.
similar to
Yes,
what you?
that's called a post-hypnotic. So you can have a verbal cue, you can have
Right.
a physical
Right, I saw
cue.
you tapping your fingers.
Yeah, I use this a lot where you just rub the thumb and index finger together. But I allow the golfers to pick whatever they want, because
Right.
so it's something that works for them, and we, then
That doesn't
create
look
an
obscene
anchor
on the
for
golf course, like slapping yourself on top of the head.
them. Yeah, I mean,
Something subtle.
yeah. Sometimes, like I've had golfers that always wear hats, and they'll just with their cap, they move it back and forth, or
A lot of athletes do that unconsciously. Like the
Right, they have what they call
batters
superstitions.
have a routine they
Yeah,
go
yeah,
through with the
exactly.
superstitions. Exactly.
yeah.
And
And that superstition, so I don't believe in bad luck. We create our own luck, if you want to call it luck. But for them, it works because that's my belief. That then becomes a hardwired program that, hey, if I listen to this song before I get out on the tennis court, I am going to win.
Right.
If I put my shoes on this way and tie them this way, then I'm going to win.
Yeah.
And that's so it self-fulfilling prophecy. And it becomes their own belief system, and they operate and they create from that belief system.
So, how do you differentiate from these things that we've identified and that you've listed, work that you can do, to spiritual hypnosis? And then could you talk to the issue, because it's connected, for me at any rate, past life regressions? So what is spiritual hypnosis? How's that used? Why would you use it? And then could you segue into what you understand about past life regressions?
Yeah, so spiritual hypnosis. I came from that belief early on when I started my own meditation practice back in my 20s. It became part of my belief system that I am a spiritual being having a human experience. So it was just a logical, I guess, place to go. I started out doing more smoking cessation, weight reduction, building confidence, reducing anxiety, things of that nature. But it was a logical place for me to go to be able to work with past life regression. And at first it was something that I was fascinated with. I was doing it on my own for myself through meditative work, which really is not that much different than hypnosis. It's still an altered state of consciousness. Hopefully we're reaching that theta brainwave state. I also realized it could be very therapeutic for people, because I began to learn and understand, and this was from reading various different books, but I did read a lot of Dr. Brian Weiss too, and what he had learned and discovered through his practice and his work, that we can work with a lot of trauma and removing trauma and fears and things of that nature by going back to past lives, because we can carry that information over. We can carry that emotional trauma from past lives into current lives. So that's when I realized, hey, is not just a fascinating topic to me, but it can also help people therapeutically.
So if somebody were to say, oh, that's hokey, I don't believe in that, I don't believe in past lives, so what would you say to that person?
Well, I don't think that you have to believe in it. If that's not something that they would want to do, we wouldn't do that. But sometimes, just like happened with Brian Weiss, he didn't believe in it. He was a psychiatrist, an MD. He was agnostic. It happened spontaneously, and he talks about it in his books, Many Lives, Many Masters, with his first initial patient, which he calls Catherine. And he was working on a lot of extreme phobias with her, and she spontaneously... He was just doing a regression, meaning current life regression, and she did regress back to a past lifetime. I think it was like 1800s, 1863 maybe. And this helped with a lot of her phobias and stuff. So he didn't believe in it either. I don't think that you have to believe in it. If people say, well, how do you know it's not just, your imagination, your mind making up these stories? And I said, well, maybe it is. Our entire life is a story. We call it a narrative, or
Right.
We call it narrative therapy when we work with people's stories and their narrative. So, if that's the case, if it helps you, who cares whether your mind's just making it up or not? Because we story everything, and it comes from our perspective. So, if it's helpful, then let's try it. I don't tell them they have to believe it.
It's a very empirical approach. We're talking about hypnosis, but that's a very empirical approach. If it works, use it. If it doesn't work, then it doesn't work.
But you can come to it just from wherever you are. So you can go and say, okay, I would like to allow myself to experience being hypnotized. Maybe I can be hypnotized, maybe I can't. You don't have to go in with a preconceived idea. Yeah. You can just go in and you can have the experience and then see what happens. And based on the result of that experience, you can decide whether or not that is beneficial and do it again or not.
Right.
And I think people get very comfortable with the idea of hypnosis too when you educate them on it, because when they understand, oh, I do this all day every day. It's not just for athletes, it's not just when you're driving. I mean, if you get lost in any sort of activity, that's the number one symptom that people, if you want to call it a symptom, people recognize of hypnosis is time distortion. You get lost in an activity. Let's say you love painting. You go down in your studio and you start painting, and you thought you were only down there for an hour, but it's been 4 hours. Right. Well, you were in what we call waking stage hypnosis, but a light hypnotic state.
Well, it's like a form of dissociation. Yes. You look at somebody that has dissociative identity, and they lose time, and that's one of the symptoms that you identify it by. But when you go away somewhere because you're really absorbed in something that you're attending to, then your unconscious can explore. And as you were saying, if somebody's driving a car, you break up with your girlfriend, you're devastated, you're really preoccupied by what happened, why did it happen, whatever, and you stop driving your car and you look up and you're in her driveway. You didn't intend to go there, or you pick up the phone and dial her number, and you didn't intend to call her, but your body is trying to make you do what your unconscious wants you to do. So this is just a new way to listen to that and make sense out of it, and then find a way to harness it that's productive.
Yes.
Okay.
Exactly.
So hopefully this has been good and people have enjoyed this. We know that everybody loves to talk about hypnosis, so hopefully we will have Kelly back at some point and she will grace us with her presence.
We'll again make her come back. How's that?
She can hypnotize herself.
I might be suggestible
to that. She can't do that. Exactly.
So if you guys have questions or comments, please get us through the Psych with Mike page, www.psychwithmike.com. As always, if it's Friday, it's Psych with Mike.